Hi, everybody. It's Angel from Brain Tumor Companion and Meningioma Companion. Today, we just had a great Zoom educational interview with Dr. Nati Ben-Shalom from New York's Lenox Hill. Many of you know Lenox Hill from the Netflix show that we've talked about in the past on this platform. Anyhow, Dr. Nati, who is what we'll call him, he is the neuroplastics and reconstructive surgeon over there at Lenox Hill, and he had some great before and after pictures to show us of kind of the unique specialty that he is and the really expertise of the work that he does to transform us back to looking normal. For a lot of us post a craniotomy, we might have some visible changes, whether that's a dent in our head or a lump in our head or some scar tissue that is problematic, or even just a lot of pain. And so he kind of talks through a lot of the options that we have to recover from that. We don't have to live with that if we don't want to. So unfortunately, due to some technical difficulties, his beautiful slideshow of before and after images and his presentation part of it is not on tape. However, we will pick up with Diane, who is from New York. She will share a little bit of her story of being a Lenox Hill patient, as well as a patient of Dr. Nati's, and what her reconstructive surgery did for her. And then you'll get to see some Q&A with the brain tumor companions who were able to join today to learn a little bit more about what we can do given the new titanium plates and parts and pins and all the stuff that we deal with on this journey. So I hope you enjoy the educational Zoom. I thank everybody at Lenox Hill. They're an amazing team. If you want to reach out to any of them, please let me know. I will get you in contact with them. You can always email me directly with any questions or concerns at angel@braintumorcompanion.com. Again, that's angel@braintumorcompanion.com. So enjoy the educational Zoom. We certainly did. Take care. Bye-bye.
After I found out that I had a brain tumor, as I said, I live on Long Island. They gave me an opportunity to speak with a doctor in the town that I live in. And he said to me that he could see me in 3 weeks. He could, I needed to get the tumor out in 3 weeks, and that he could see me like in 2 days to get the surgery done. And he was going to shave my entire head. And I was talking with my sister, who lived in the city, and she lived in one of the boroughs. And she said to me, "You live on the island and you live in the shadow of the biggest city in the world. People fly from all over the place to go to New York City. I want you to go to New York City and see a doctor in the city." And she said, "The doctor you're seeing may be great. However, not to say anything wrong about this doctor, you don't want a doctor who could take you on Wednesday. You want a doctor who does so many surgeries that they need a week or so before they could take you, because they're so busy. They have a little bit more experience." She said, "Let's just go to the city." So we looked up some doctors who were in my medical insurance, and some doctors who she had gotten recommendations. She was my older sister, and she'd gotten a few recommendations from Dr. Langer and his team. And I saw Dr. Bookvar, who was able to see me. And I sat with Dr. Bookvar, and he said to me, "Also, you have to have this tumor out within 3 weeks, but I could see you in about a week and a half. I'm very, very busy. I could see you in about a week and a half." And we talked about a lot of things. And again, I mentioned I lost a significant amount of weight. He said, "Your weight is an issue. You may wind up in rehab for a little bit of time based on your weight. You going to be concerned that you might have a stroke, trauma, all sorts of different things." And my daughter is sitting next to me diligently taking notes, and my sister is saying, "He has to tell you all these things. He has to tell you all these things. I don't have to tell you. You've had the experience. It's an out-of-body experience when you're listening to this." All I'm thinking is, I'm on General Hospital. That's the only place people get brain tumors. None of this is real. And he said to me, "We don't have to shave your entire head. I'm going to take out a little bit here." And it was before I was gray, so I had long, dark hair. And he said, it's going to be okay. He said, "Your biggest issue right now," he says, "it's not my job, it's your weight. He said, based on where your brain tumor is located, he said, you're lucky. It's in your right frontal lobe. He said, you have a decent sized brain, but there's a lot of space in there. Don't worry about it. We're going to get it out. You're going to be okay. And I was very lucky. I went in, things went well. It was a big experience. I left the hospital a little too soon. I was in a rush. I got out in 4 days. I went home. I went back to work in 6 weeks because I'm not a person who sits. I rushed. I went into counseling. I was in counseling for a couple of years. Dr. Bookvar is an amazing doctor. His team is incredible. And I have, I'm on seizure medication, and I struggle to lose weight and stay healthy. And over this period of time, I've lost 100 pounds. So it's been great. In the last few years, as I've lost weight and as I've gotten older, I really started to notice that my plate here and my plate here started to stick out. Since I've had brain surgery, I would for sure say that a conversation, if you've met me, in the first 45 minutes you've spoken to me, I would mention I am a brain tumor survivor. It is one of the things that you talk about. I probably mention it faster than I've lost weight. I have a seizure condition and I am a brain tumor survivor. It's the things that come out. If we're someplace and we have to lift things, the fact that I have a bad back is a reality because you're standing there bending and lifting and I'm standing there waving at you because I'm not doing it. I have herniated discs. So that comes out because I feel like you think I'm lazy. But you feel like people are looking at your plates. You can't help it. They're obvious. The ones up here, I might not have even known I had the doctor not mentioned they needed to come out. But you get older. As Nati said, your skin gets thinner. I lost weight. My skin got thinner. I'm using all sorts of creams to get rid of the wrinkles. Maybe my skin got thinner. I don't know. But you feel like people can see your plates. There was only so much bangs you could cover them with. And you feel like people look at you. I public speak for a living. I'm in front of a room, and the last few years in front of a Zoom, many hours of the day. Pre-COVID, you're walking up to people, you're shaking hands, you're fundraising, you're in a group, and people are noticing you. You're getting your hair washed, and people are feeling the bumps in your head. Mm-hmm. One of the things that I do for a living is we talk about domestic violence. I work in an abuse agency. So we're talking to people who wash hair for a living and saying to them, if you feel somebody's head and you're worried that, their victim is being smashed up against the wall, and I'm sorry, these are harsh topics, these are some things you might want to ask to see if they're being abused. And of course, I'm thinking, well, my head's bumpy. And then I'll wind up talking about what my head might feel like to somebody else. It's always in the forefront of your mind, how you look, how people think about you. How we live in a world where you always feel like you're in high school. No matter what people say, people are looking at you. When I came out this morning, did they notice I didn't hem my pants, or my grandson smushed his snotty nose on me, or whatever it might be? Life is life. About, I don't know, maybe 6 months ago, I started getting some real pain in my neck coming up the side of my head. I'm a migraine sufferer as well. I'm sure a lot of us are. And I didn't say anything. I didn't go to the doctor, because the minute you go to the doctor, if you mention anything with your head, it's an MRI and go see your brain surgeon. I love Dr. Bookvar. He's an amazing human being. But from Long Island to New York City is a day off from work. It's a sick day. I won't drive to the city by myself. So it's my partner has to take a day off from work. Not easy for him. It is leaving god awful early in the morning. It's a busy, busy day. And it's the emotional stress of, what are they going to find? Weeping about it, and days loss of sleep. If I get a bad eye test, my eye doctor is, that could be a sign of regrowth on your brain tumor. Okay. You sneeze twice and they send you back to see your neurosurgeon. Again, I love him. It's like going to see a movie star when I get to see Dr. Bukvar. He's fabulous. He's ageless. And his team tells me never tell him that. Okay. He's a fabulous man. But the reality is the fear is incredible before I go see him, not because of him, but because of the worry that we all experience. So at the end of the day, I wait before I see doctors about things that I worry about. I called my neurologist who sees me for my epilepsy and my migraines. I explained it. He said, you know, it sounds like your shoulder, you have arthritis in your neck, arthritis in your back, upper and middle. Go see that doctor. I waited 3 more months. I went to see that doctor. He said to me, where is the pain? I said to him, here, here. He said, what about your head? I said, some of it's coming up in here. So he said to me, got to get an MRI, Diane. So of course I walked out crying. I yelled at his nurse, which I shouldn't have. She followed me into the bathroom. She said to me, she sat with me for 15 minutes and talked me through it. We did some processing. I had my MRIs. I went to the city 3 hours. By the time we got in there, I thought my husband was going to divorce me, but he is an amazing human being who has seen me through this entire thing. We went in. Dr. Bukvar said to me, your brain is beautiful. And I met Nati because Dr. Bukvar said to me, your plates don't look good since the last time I've seen you. And that's kudos to him that with all the patients he sees, he remembered that my plates don't look good. He said to me, I said to him, I lost more weight since the last time I've seen you. I'm up to 100 solid pounds. I did a little dance. And he said to me, they're sticking out too much. So I said, well, I got thinner. My skin is thinner. He said, those are all great things, Diane, but they're coming out too far. Now, I've seen a few other doctors and I've mentioned my plates feel like they're moving. They feel like they're moving. Did I ever mention it to Dr. Bukvar? Not once, because when I go in to see him, I'm sitting there like this. Tell me there's no regrowth on that tumor. That is all I'm thinking about. Let me go out and have a pretend martini because I can't drink anymore. So I call them mental martinis. And I go out and I have breakfast and I have cake and I have ice cream and then I get back on my diet the next day. But I do not think about anything except tell me there's no regrowth. I can't think of one question that I thought I should ask him. And he says to me, is there anything else? And I say nothing. And I leave and I cry. Nothing else. Okay. The reality is I have felt that pain in my forehead. And he said to me, we can't guarantee you won't get any more pain in your neck, but we can probably relieve the pain that you're feeling here and here. And Nati took a look at my head and I made some jokes about maybe getting rid of my 11s that I have over here because I hurt so much. And Amy, who is like the most wonderful human being you can ever meet, because I'm a bit on the neurotic side on a good day. And I think I call her, I don't know, 4 times a week to talk about everything, including, can I color my eyebrows? I feel stressed. And I went in for the surgery and they really talked to me about the fact of don't wait until these plates are coming through your skin, because the older you get, the more realistic is that's going to happen. And I decided to do it this June. That for me was slightly tough because I'm a swimmer and I didn't realize I wouldn't be able to go to the beach and swim. But overall, it turned out well. I don't know if you could see over here, my hair is already coming back. They went right over my same scar line where I had my surgery down and in here. And I was in and out of the hospital in a day. The team at Lenox Hill is amazing. From the moment that I walked through the door, everybody is kind. My big words, because I was a YMCA employee for a long time, caring, honesty, respect, and responsibility. And that was all I saw from the moment I walked through the door. Everybody is wonderful. Everybody was sweet and kind. The surgery was fast. I'm a nervous Nelly about everything. I'm the kind of person who wears gloves and a mask during flu season before COVID got here. So for me, I have to say everybody treated me wonderfully. I have 2 children in the health field, so they fully investigated everything before I started. And I I was in and out. I was back to work in 2 weeks and ready to go back sooner, but I got the no from my medical team to stay home and chill. And I went back to work and got my stitches out, and it's healing nicely. I couldn't wait to color my hair because I'm a little vain. And other than that, the things are going well. I have to say, Amy deserves an Emmy and an Oscar and a Tony for dealing with me.
You make it sound like you're not like a treat to talk to. Yes, we spoke frequently, but you're just so much fun and like so pleasant that it's like a delight.
Thank you. And I will say it was worth it. I've recently had a couple of conversations where my go-to is, I had a brain tumor, like you're so used to saying it right away. And I bit back on it and didn't say it. And it didn't have to be part of the conversation. And it was new for me, a new experience where I just got to be Diane. And that's a really new, nice experience. And I have to say it's different. He did take out a little bit more of the wrinkles. I think maybe I'll but overall, I have to say it's a nice feeling. I am on top of that having less pain in my head. I really am. I'm still getting this, but I have arthritis here. But overall, I am getting less pain. And that is the true blessing of it all. Thank you.
Wow. Thank you, Diane, for sharing all of that. What a story. And Nati, for your great work, and Amy, for your kindness, obviously, and your great work as well. It really is so nice to have you guys back for a third educational session. And this really means a lot to us. I have nothing but great things to say all the time about everyone over there at Lenox Hill NYC. And I just love that we finally get to speak to an actual patient of yours. Really is so nice. If you guys have time, we've got about 15 minutes left. I'd love to just go around the room really quick to see who has questions from our group for you, unless you have any specific questions for us. Does that work for you guys? Okay, great. I'm gonna. It looks like I still have
Thank you,
to.
Diane. I mean, that was amazing. I was watching you, and every word you said was really like hitting me. How powerful those words are, and I want to thank you for sharing this story. You are a brave woman, not only for undergoing all of this, but also to share it in such a profound and beautiful and articulated way. And I think I'm gonna make you our champion. So
Thank you.
You are our neuroplastic champion for all.
She's gonna be your team mascot over there. Cool. All right. So then I'll quickly go around the room. Sabrina, you got a question?
Yes. So Dr. Nati. So I have a shunt. So my shunt starts here and is in my neck. So I've never heard of your procedure before. So can that help?
So what is bothering you exactly?
Well, I have no pain right now. I feel the catheter here, and I have the pieces here. So today, I have no pain. I do, like Diane, deal with migraines. So I deal with migraines because of the shunt, or is it just because that's all came new after the surgery.
So basically, when it comes to shunt device, patients that have a thin scalp, if you think about it, we have the skull, we have the scalp, and then the shunt device in between them, right? And then this is why you feel the sort of the valve or the device under your scalp. In patients, patients that have thin scalp with multiple surgeries and they really have pain and discomfort, we can really help them to embed the device inside the skull. It's not going to get rid of the neck tubing. It's not going to get rid of the neck tubing. But, you have to think about that there is a device that's pushing on your scalp from inside. And if it causes pain and discomfort, we can always see that and evaluate that and see what we can do. But one of the things that we can offer is to embed the device within the skull, so you don't feel it, you're not even aware of that, and usually the pain that related to the internal pressure is completely resolved.
Really?
Yeah.
Because I get a lot of pressure headaches.
So it will not, so again, it will not, the aim of the surgery is not to help with the pressure headaches. It does help with the local pain of the device under your scalp.
Because the pressure headaches to me are more like what I had when they first started coming up with hydrocephalus.
Right.
Understand. Well, thank you very much for your
Yeah, you're welcome.
information. Thank you.
Of course.
Thanks. Brenda, you want to ask your question?
Oh, yeah. Hi, I'm Brenda. I'm from Tucson, Arizona. I am post craniotomy 2 years this month, and it was a left frontal lobe oligodendroglioma grade 2. And then I also did 6 weeks of radiation in conjunction with chemo, and then 6 months of chemo after that. And then in December, I started having absent seizures, and now I'm on Keppra. I have a lovely dent in my head that when I go biking, rocks will collect in them. So that's interesting.
Wow.
It's so weird. But I've been having recently a lot of like pain, and I can feel all of my screws because I don't have hardly any body fat on me. So like I literally can feel every screw, every dent in my head. So my question is, when my husband, he broke his hip mountain biking, and they put in a dynamic hip screw, and he was having a lot of problems, and they just took out the hip screw 6 months later, and he was 100 times better, walked out, he limped in, walked out of surgery. So what could be done with my hardware? Could it be removed? How could what could you do? Or, what would you do in my situation where like I have a lot of pain all the time?
So first, thank you for sharing this story, and congratulations on your amazing journey. So when it comes to hardware, painful hardware, and there are two reasons. One is, as you said, when there is a low amount of fat and there are those titanium screws pushing on the scalp from the inside, it really irritates the blood supply to the scalp, which causes this pain. And when you have holes and dents and your scalp sinks in, if you think about it, it's like almost a vacuum. And when the scalp sinks into the dent or to the burr hole or to the hole, it can really irritate the skin edges around the bone, right? Because it acts like a sharp knife.
Okay.
What can be done? So Diane has, an amazing story. She had a brain tumor removal, and then with time, she got pain related to the titanium hardware. So what we can do now is obviously depends on the quality of your bone, right? We do the special CAT scan. We look at the 3D recons, and if your bone already fused to the skull, we know today that it's safe to remove all hardware. All titanium hardware is out. And patients love it because they don't feel the hardware, they don't feel the pain, and this pain can get worse with weather changes and when it's cold and so on. If we feel that the bone is not fused, and 50% of the patients, their bone is not fused, we're changing the hardware from those high-profile mini plates to a low-profile titanium mesh, which essentially will get rid of at least the pain related to those spots you'll feel under your scalp. One thing that we do as a dual purpose is we cover those burr hole sites and those dents with a mesh. So then when you heal, you don't feel any more dents, you don't feel any more bumps. And if your scar is atrophic when we evaluate it, we excise this scar and give you a fresh new scar with a good, healthy skin. Atrophic, I mean wide, white, no hair. That's what I mean with an atrophic scar. If the scar has like no hair and it's very thin, we excise that completely and give you a fresh new scar. So sometimes because of the scar is so thin, it's even more irritated when those plates are pushing on it from inside. So those are the options, but obviously you need to get a CAT scan and to evaluate everything. But it is a very strong story for the neuroplastic patient. I have pain in my hardware. The neurosurgeon tells me live with it, and I tell you let's fix it. I don't want any little rocks jumping on the blowhole when you mount them.
Yeah, every time it happens.
So bizarre. That's really crazy. All right. Well, thank you for that. Pam, you want to go next?
May I?
Yeah, absolutely.
Hi, Dr. Nati. I also have a shunt that was placed a couple days after my surgery because of hydrocephalus. Now, I saw on some of your slides, Dr. Quinones's name that was mentioned. He did my surgery and my shunt from Mayo. Is he involved with this plastic surgery also?
That's a great question. Dr. Quinones was at Hopkins when they started this field called neuroplastic surgery. So basically, Dr. Q was one of the first ones together with the neuroplastic group to engage in this endeavor and send patients and value that. So we are very, Dr. Quinones and the Johns Hopkins Neuroplastic Service are very close together, and he's very much involved in that since the beginning. He obviously did not have the training as a neuroplastic surgeon, but he has the expertise and the knowledge and the experience to, direct you in the right way, or any patient that goes to his service. Once you bring it up, you can definitely mention neuroplastic surgery, and I'm sure he will be happy to hear that you heard about that talk.
Well, what I was going to say is I have 2 incisions, one from the shunt, which I can feel, just like Sabrina said, when I run my hand over it. And I have another incision where I had my craniotomy. And truthfully, my scalp is very uncomfortable to this day. And my surgery it's going to be 3 years this October. My scalp feels tight, numbish still. I mean, I can feel it, but it's like feels like a hard head. I do have a hard head, but it just doesn't feel any better than it did immediately after surgery. And I don't know why. Could you give some explanation for that? Is it normal for your scalp to still not feel normal like it did?
It's very hard to speak about specific kind of problems without seeing the scalp and the imaging and understanding the story. I would advise, is he still your neurosurgeon? Is he
Well, I live in Pennsylvania. I had my surgery at the Mayo Clinic in Jacksonville. We do virtual talks, but I am planning on seeing him sometime this fall because he does want to see me physically. So I do plan on, seeing him.
Yeah. So if I would definitely ask him about your scalp pain and incisional pain and see if he has any advice to you. And after you see him, and basically he was there, what he did. After you see him, ask him if he has, any, what's his thoughts on seeing a neuroplastic surgeon. And if you opt for it, I'll be happy to see you either in New York or send you to my colleagues in Baltimore, whatever is more convenience to you. But if this is not getting any better and you're suffering, you should really evaluate it and understand why. You should not suffer 3 years after surgery.
I'm always aware of the fact that I had surgery because of that. Yeah. Even when I move my head now, It just feels like it's an indescribable feeling. I can't even, not that it's different or worse, but it's just still not normal.
Yeah. Thanks for sharing, Pam.
Thank you very much.
We've got about 3 minutes left. Do you have time for another question, Nati, or should we
Sure.
wrap up? Yeah.
Yeah,
Okay.
sure. Let's have another question.
Karen has a Diane. Do you need to go?
I need to go. I have another speaking engagement. I want to thank everybody so much for having me today. Thank
Such a
you.
pleasure.
Thank you.
Thank
Thanks,
you,
Diane.
Thank you.
Care.
Thank you, Diane.
Karen has a quick question. We can
Yeah.
roll with hers.
Okay. I'm Karen. I'm from outside San Francisco, California. I was diagnosed with a left temporal lobe meningioma about 4 years ago. So I'm currently on watch and wait. My question is, because I've had a lot of MRIs like everyone else here, any plans to incorporate the use of the 7 Tesla MRI scanner once it becomes available?
Yeah, 7 Tesla MRIs is still an experimental study. I'm sure that with time we'll know more and more about, the qualities and the implications of doing that MRI. Right now, we don't use it at Lenox Hill, and we don't actually use that quite often for brain tumor patients as we get all the information we need from 1.5 and 3 Teslas. For some patients, which are experimental functional epilepsy patients, can get a 7 Tesla MRI if they want to engage in sort of clinical trials. That's what I'm aware of when it comes to epilepsy, but this is not the standard of care as of today.
Okay, thank you. That's interesting. Thank you.
You're welcome.
Thank you. Does anyone else have anything they want to ask or share at this time? Donna?
So I'm Donna. I live in Raleigh, and I had a left frontal lobe meningioma removed about 2.5 years ago. And after surgery, I had a stroke. So it took me, I was in ICU for 2 weeks and rehab for 3. And so my question is, I have, I do have, I mean, it's covered by my hair and it doesn't bother me, but I do have, like, I can feel the dents and the scars, like right here. I cover it with my hair, and then it comes back like this. And I call it my blowhole because I can feel like air coming out of it. Is that normal?
You feeling air coming out of it?
Yeah, like, I mean, it feels like sometimes when I breathe, I can, like, I don't know if I feel it or I just hear it.
Well, hearing stuff, when was your surgery?
2.5 years ago.
Okay. Well, hearing weird sounds and having weird sensations is normal as long as your wound is closed. I mean, air for me sounds like there is a movement of air in between the extracranial space and the intracranial space, which is not good, but this is not your case. If you just have like a weird sound and sensation and sometimes movement and pulsation of the scalp, this is normal, or let's say normal to somebody that had a craniotomy. But definitely if it bothers you, there are things to consider if this is bothering you enough to at this point that you just don't want to deal with it anymore. Obviously there are ways to fix that.
One more question that I have is, like, I've been told that I don't have any kind of pins or screws, but yet right here I feel something. Is it possible to have brain surgery and not have any pins or screws? They said I have clips. I don't really know what that means.
Yeah, there are some clips. Yeah, there are some clips, but those are just a different mechanism to attach the bone.
Okay.
Yeah, just a different mechanism to attach the bone, essentially.
Thank you for that. I appreciate it.
You're welcome.
Yeah.
All right.
Yeah, so is this time for you to go,
Yes.
Dr. Nati? Okay.
Yes.
All right. Well, we all really thank you for your time and attention today. You guys over there are doing such great work, and we really are proud to have a relationship with you all. Please do send us any patients who you think could benefit from getting to know us and sitting in our peer-to-peer support groups, which I host every single week. This week marks my 2-year anniversary of brain tumor companion and meningioma companion. So it's been a really exciting time to meet a lot of peer-to-peer people and just help each other out, educate each other, and meet wonderful physicians like yourself. So thank you so much for your time and everything that you do. Your team is
amazing. So much, all of you guys. And Angel, please share with the group my email. So if they want to continue ask any questions or have any concerns, please feel free to email me.
Thank you.
Absolutely.
Okay, thank you.
I
Thank
will
you, Nati.
too. Thanks, and thank you for the slide presentation. That was really quite amazing. It was really
Yeah.
good.
Yes.
All right.
Thank you all very much.
Take
Thank you.
care.
Thank
Bye-bye.
you.
Have a good
Have
week.
a good one. Bye-bye.